Hi, I'm Gene Beresin from the Clay Center for Young Healthy Minds at the Massachusetts General Hospital. And today I want to talk with you a little bit about something that's super important. It's a trend that can be incredibly destructive, if not uh, extraordinarily dangerous for our young boys and men. Now, we know that in society, women and girls have been plagued with pressures towards thinness. Boys have been largely spared of this, although there was a trend from between the 60s and 80s to look like an action hero with big muscular chests and a V-tapered waist. But now there's a trend called Looksmaxxing, which is basically streaming videos online that defines who you are by the mathematical metrics of what you should look like: the size of your waist, muscularity, angled jaw, and what's called hunter eyes. And this can be very destructive because it requires that you actually define yourself by what you look like. Clavicular, who is the iconic leader of this movement, defines three subtypes of who people are: subhuman, which is unbelievably terrible; normie, which is a normal; and Chad. Chad, which is the ideal, which means that you're thin, muscular, white, and wealthy. It's misogynistic, and it can cause severe complications. There's soft maxing, which is the application of creams or other uh, relatively innocuous material that you can apply to your skin. But then there's hard maxing, which can include jaw smashing and surgical procedures to alter the shape of your body. They can cause all sorts of physical and mental consequences. In terms of mental consequences, Looksmaxxing and online social media streaming about appearance is associated with body dysmorphic disorder, which is a preoccupation for how you perceive parts of your body, which are really unrealistic and out of touch with how other people see you. It's also been associated with eating disorders, with depression, anxiety, and even suicidal thinking. So this trend preys upon vulnerable boys and young men to define who they are by what they look like. Now, what can we do about this? First of all, it's so important that we all are aware that this is a streaming phenomenon. So if you as a parent or caregiver notice that your young boys or young men are checking the mirror all the time, are isolating themselves socially, are complaining about their appearance, are changing in their diet, are watching streaming video endlessly, and really defining themselves by the use of social media, you need to take some initiative, such as having conversations about how they feel about their body, how they feel about their looks, what defines them as a person. I think conversations about identity, about who one is, should begin preschool. And it's not who you look like, it's who you are, to quote Jackson Brown in the famous song Rosie from Running on Empty. What do you like as a person? What are your values? What do you do in your relationships? Are you a caring person? Are you honest? Are you trustworthy? This defines who you are and not your appearance. Appearance is really secondary. These kind of conversations should be ongoing and should start early. I mean, about identity. And so I would really encourage you to look at the blog that I've written on the Clay Center site. I've also been interviewed by NPR, and there's also a blog on Psychology Today, and learn more about Looksmaxxing. And remember, this is a marathon, it's not a sprint. We as parents and caregivers need to talk with our kids from preschool all the way through adulthood about issues such as appearance, identity, values, and then what to do about it if we see problems. Thanks.